So I'm a lung cancer researcher and actually lung cancer oncologist at the UPMC Hillman Cancer Center. So I see patients one day a week and the rest of the time I'm in the lab. And what I'm really interested in, both in the clinic and in the lab, is trying to find new targeted therapies for our patients. So really the major advance that's happened in lung cancer over the last 10 years is the fact that lung cancer is made up of a number of genes that we can target. And when we use a targeted therapy in these patients, oftentimes they can have responses for years in some cases. Unfortunately, these patients often progress. And for other of these patients, we know the target, but we don't have a good drug for it. So what my work in the lab focuses on is trying to find new drugs for these patients. And in the clinic, trying to run clinical trials to make what we do in the lab actually work in the clinic. I think what's really important for lung cancer research in general and cancer research in general is to make sure that patients are getting their tumors tested. We know a lot these days and we can do a lot for our patients, both in the lab and in the clinic. And so I think it's very important that everyone get their tumor tested, especially in lung cancer. So the American Cancer Society has been instrumental in my work and actually my career. So as a physician scientist, we're torn in many directions. We're seeing patients in the clinic. We're also trying to run labs. And the American Cancer Society has really given me the opportunity to kind of expand my research and really establish myself as a physician scientist and really allowed me to try to bring stuff that I do in the clinic, in the lab, to actually into the clinic. So I'll be forever grateful, and I'm still a few more years left, but I'm quite excited to be an American Cancer Society research scholar.